Welcome to the third season of the Florida Institute for Child Welfare podcast. I am Jessica Price, your host. In this season, we're exploring perspectives on the Family First Prevention and Services Act. We are talking with child welfare leaders and community advocates about how Family First will impact our state. Today on the Florida Institute for Child Welfare podcast, we are discussing Florida's plan for implementing FFPSA. I would like to welcome Ginger Griffeth, the Director of Policy and Practice at the Department of Children and Families in the Office of Child Welfare. Thanks for being here, Ginger.
Thank you. Thank you for having me.
All right. Well, Ginger, let's get started by telling our listeners what brought you into child welfare.
Absolutely. So I started my career in child welfare almost 19 years ago now. I began in the front lines with the Department of Children and Families as a case manager. Really didn't know a lot about child welfare. I was fresh out of college with my psychology degree, ready to make an impact on the world, and entered the field as an opportunity to have an impact on the community in which I lived, and then very quickly fell in love with child welfare. In fact, I can't imagine doing anything else. Then I had the opportunity to serve in multiple roles, from case manager, supervisor, quality assurance, being able to work in the front lines with a case management organization, serving multiple counties, even outside my own community, and then ultimately working with the community-based care agency around the implementation of practice models, which became a highly loved subject for me and actually paved my way and my transition back into the department with the implementation of Florida's practice model as part of the Title IV waiver. And so from there, I've been working in the Office of Child Welfare for about the last 7 years, serving in multiple roles there. And currently, I am the Director of Policy and Practice and have an opportunity to work with key partners from across the state on multiple child welfare issues, as well as on the national level, which is pretty exciting. And so when Family First Prevention Services Act was released, Florida was poised and very excited to begin the implementation and thinking about what that could mean for Florida.
That is a great segue into, the next part of the conversation, family first, and what is it, for one thing. I know that you have been talking about this for at least 2 years now, probably more. And I've heard you talk about it several times, and I learn something new every time. So can you give us simply what is it and how will it impact Florida?
So to simplify, it can be a little bit difficult. The act is quite large. It has 8 different sections. It really is a complex act, but it really boils down to sort of 3 key elements. One, the act really intends to reform the Florida child welfare financing streams to provide services to families who are at risk for entering the child welfare system. Secondly, it really focuses on or aims to prevent children from entering the foster care system by allowing us, the state, federal reimbursement for mental health services, substance use services, and in-home parenting skill services. And then lastly, it really seeks to improve the well-being of the children that we already serve in our foster care system by incentivizing states to reduce placement of children in congregate care, or what you may be better known as group home settings. And so those 3 key elements, though stated simply, are pretty complex to sort of operationalize and ensure. And while permanency for states and the Children's Bureau has been a long-standing key goal, FFPSA to me adds new criteria and funding streams to help us keep families together, encourage family foster care placements, and right-size our current use of congregate care settings.
And I appreciate you giving us that overview. Yesterday, we did a talk with Executive Director of Prevent Child Abuse Florida, and we talked about prevention and what that really means. So what does it mean to you, Ginger, in connection with Family First? Because I know there's multiple levels of prevention. So when you say prevention, what are you alluding to, or what is your definition?
So I think prevention means multiple things. There is no one prevention approach, one prevention worker. I think in every part of our system, there's an opportunity for prevention. And that's sort of the way that we're approaching FFPSA and thinking about it as a holistic shift and hardwiring prevention throughout our whole system of care. No matter what door you enter or don't enter, even if it's just a contact in the community, that we are building a service array, building that partnership, and building case coordination nets or care coordination nets throughout the state that really hardwires prevention from beginning to end. And that's something Florida hasn't historically done from a child welfare perspective lens. Typically, families came to us through a call to the hotline in which they were screened in. We investigated, and then, of course, if they needed formalized case management, we would work that route. But if that wasn't needed, then the Title IV waiver actually gave us an opportunity to provide prevention services. So we sort of see FFPSA as an opportunity to expand even beyond that, and it really becoming sort of an early, upfront, family-centered, trauma-informed shift in the way that the department delivers services, builds those connections and community relationships, and really try to build a way to leverage as much federal support as we can to help expand those and fund those and resource those partnerships and collaborations.
Wow, that's really exciting. I love the part about we're not just doing one stage of prevention. We want it to be throughout the entire process. This is our lens of the way in which we're going to do our work moving forward. And I think that's incredibly important. So when it comes to implementation of Family First here in Florida, are there any overarching or major goals that the listeners should know we're working towards?
So yeah, Florida has 3 major implementation goals that we're working towards with FFPSA. And those 3 goals are prevent, engage, and provide. So for Florida, we really are focusing on activities, initiatives, and services that prevent entry into foster care, again, by hardwiring it throughout our system, from the community level all the way through the child welfare system, and even support past child welfare and our engagement with families. And secondly, it's engage. Really engaging families around the utilization of prevention services, doing that early, really delivering those services where they are, and to address any needs that they have to avert any crisis or need for the child welfare system in the future. And then lastly, the provide is really focused on if children do have to enter our child welfare system, what do we need to build and ensure that we have to make sure that our care is the least restrictive environment in terms of placements, whether that be keeping families together, focusing on relative, non-relative placements, ensuring that our foster home or a licensed foster care array has settings that are tailored to the child's individual needs, even into our congregate care settings, and assuring that those are tailored to the individual and specific needs of the child as well. So again, those are prevent, engage, and provide. And we've really built our whole implementation strategy and initiatives around those 3 focal points.
I love that. Prevent, engage, provide. And with those in mind, I'm curious about how are we going to do this? I've been listening to you talk, and I've been hearing so many presentations about it. And those that are listening in, what should they expect? Is there a main strategy? Is there a staged approach? How are we going about this in Florida?
So that's an excellent question. So we in Florida are trying to build on sort of our journey from being a Title IV waiver state. So most folks know that for Florida, we've been a waiver state for more than 10 years, which basically means we were able to leverage as a waiver state federal dollars, not just for utilization for kids that were placed in out-of-home care, but also for kids that were maintained in their home. And not all states were allowed to use this waiver, but Florida under that waiver took a much different approach than other states and used it holistically to sort of reform and redefine our funding streams to our privatized community-based care agencies, as well as roll out a whole new practice model that really differentiated and defined what our prevention populations look like versus what our formalized case management populations look like. And so under that waiver, we had an opportunity to build the technology and the policy and the beginning infrastructure for prevention responses that a lot of the FFPSA language was sort of written around. They used the waiver states, the children's bureaus did, and what they learned from those waiver states to really inform FFPSA and the way that the act was written. And so Florida was really poised to sort of walk through this phased approach with 4 different phases. And the first phase, we really focused on what did we need to do to maximize maintaining those supports for our prevention activities that we would lose under the waiver when the waiver went away in October 2019. And as we prepared for our implementation of FFPSA, which will go into effect in October of 2021. And so that first phase really focused on our path forward activities, as we called them. What were the strategies to maximize claiming while filling gaps within our system to better serve families and achieve the outcomes that we wanted around permanency, safety, and well-being? So a lot of our phase 1 activities were sort of that path forward in the interim sort of steps between when our waiver ended and our utilization of the waiver dollars, and then where we would be with FFPSA in that transition. And then after that, we really focused on the main pieces of the act, which you've heard me talk about, which is about quality placement in phase 2, which are the required elements of the act, really taking a look at what our placement array looks like in Florida. What is the capacity? What are the needs of the children in Florida in terms of placement and their involvement with the child welfare system? How do we make sure we have those quality settings in place at the right capacity, and then carving out the new sort of FFPSA congregate care specified settings. So phase 2 work is really focused on quality placement alignment. That's been going on for, oh my goodness, a couple of years now in conjunction with phase 1. Now, Florida, we're always doing things simultaneously. So I'm talking about these in terms of phases, but all of this work is happening concurrently. So I want to be really clear about that. And so phase 1, path forward, phase 2, the required elements of the act around placement alignment. And then we broke up our prevention work, or the prevention pieces of FFPSA, into 2 different strategic phases. And we did that because of Florida's journey off of the waiver and our opportunity to learn from our use of waiver dollars around prevention. So we have prevention really broken up into a phase 3 and a phase 4 approach that, again, are being worked concurrently, with phase 3 really focusing on and building on what we had already established under the waiver for child welfare clients. And what I mean by that is for clients who had a call to the hotline and were screened in, but perhaps didn't require a removal, but could be worked with and kept the family intact in home, or those families really just had some conditions within their homes that they needed support, but didn't rise to the level of formal intervention. And so phase 3 is really focused on aligning with what's already required in the act that Florida has in place, and being able to begin to leverage and benefit from this new sort of federal claiming that's being allowed under FFPSA. Now, with the vision of FFPSA, we knew we wanted to go beyond where we had already been under the waiver. We wanted to expand that, build on that, and really try to partner and leverage with some great opportunities and great work that communities were already doing across the state, work with their children's services councils, their children's trusts, their children alliance, or just really grassroots homegrown community prevention work that's going on across the state. And so that focus is really our phase 4, in which we're trying to partner with those particular agencies or programs as much as possible to move our prevention upstream into the community, support the community as much as we can as a Title IV agency, and our ability to leverage funding around prevention services and help direct some of that to the communities, so they can even expand and be able to serve more clients upstream. And so this 4-phased approach is really focused on, how do we transition off the waiver? How do we make sure that the kids that we serve in care have the best, most family-like quality settings that are tailored to their needs? And then lastly, how do we really build on what we have worked on under the Title IV waiver with prevention for child welfare clients, and push it out even further and even early and further upstream to the community, and formalize some of those really innovative care coordination networks that are already in place, and help be able to support some of those with perhaps some federal funding that we'd help draw down or be able to support.
That was really helpful. What stuck out to me was that stage 3 and stage 4, especially around the conversation with kind of, I think your term was homegrown, or folks that are doing some really innovative and creative work that may not be formalized or may not be evaluated. So I'm curious if you could give the listeners an idea of, if you are an agency or you have some work or interventions that you've been using that are homegrown, what are the implications around funding? Are opportunities to be evaluated on the table? What should we be doing if we're working on things that may not be seen as evidence-based right now?
The Act really does have a heavy emphasis on already established evidence-based services, as you mentioned, Dr. Price. But certainly we understand that the intent of the Act is to be able to uncover those homegrown services that have been developed in states across the nation that are truly having an impact, and be able to bring those particular services or those particular approaches to light, build evidence around them to be able to show the true impact of those services, and actually get them evaluated and promoted to, and I'm going to use that term, promoted to, the Children's Bureau's clearinghouse, in which, as you know, is a required sort of menu of services for states to be able to select from if they intend to claim for FFPSA prevention services. And so I think it's a marvelous sort of build on, again, what the Children's Bureau tried to do with waiver states, and take in a service in a particular geographical area that truly was promising and showing outcomes for families, helping build the evidence around it and get it highlighted and spotlighted, and on a clearinghouse in which it could get more visibility and utilization to serve and help more families. And so in our approach, certainly in our first phase approach, we want to take advantage of those well-established, well-supported services that are already on the clearinghouse. But part of our implementation is focusing on a couple of other phases. Are there services that are already existing out there that perhaps are on other clearinghouses that we could partner with those providers around, or those community-based care agencies around, to do technical reviews and help support that through some of our Transition Act dollars and get those on the clearinghouse, as well as working with the Florida Coalition for Children to build a mechanism to have those homegrown services elevated up through a process to prioritize them for evaluation. And then ultimately, our hope is to get those on the clearinghouse for claiming as well. So great opportunity for states, one, to utilize things we already know work well, but also an opportunity for us to really dive into evaluation and outcomes and start to highlight some of the services that are homegrown in Florida that are already having an impact.
Absolutely. We have been receiving kind of feedback around folks that say things like, we're doing the work and we don't want to be told we have to do a certain thing. So I'm glad we touched on this, so they have an idea of, we're not going to try to overhaul everything you're doing. We want to help provide some robust evidence for what's making an impact in your community. So I'm really glad we touched on that. I know there's also this broader element of, how do we draw down these dollars and who's eligible? So can you walk us through Candidacy and what the plan for Florida is around that?
So just to give some context, certainly the prevention vision for Florida, especially around child welfare and our partnerships with community, is that prevention response and that prevention service delivery is larger than just FFPSA. And what I mean by that is the core of FFPSA is around setting states up for the ability to claim federal dollars for the support of the delivery of evidence-based services. Now, that's excellent and great. And I'm going to talk a little bit about how we will be able to do that and what's required federally for us to do that. But I do just want to make sure that I'm very clear that we believe that the vision for Florida and prevention even goes beyond evidence-based prevention services and expands beyond the vision of FFPSA. And for us, FFPSA is just the beginning. But to be able to do what I'm describing, there are definitely requirements, as there often are with the Children's Bureau, about how we go about claiming for these evidence-based services and serving populations who are at risk for foster care. And so kind of the first step in that is, if we want to be able to support families with these evidence-based services and be able to leverage federal dollars to do that, the first thing that the Children's Bureau requires, or ACF requires, is that the child be a candidate. And basically, states get to define what a candidate is, but they have to be at risk for foster care. And so we have to be able to define for our state what that looks like. And of course, the Children's Bureau gets to approve that definition. But for Florida and our vision for where prevention needs to go, we tried to make that definition as broad as possible, staying within the intent and spirit of the language that the Children's Bureau published in FFPSA, but knowing that we had learned a lot from the waiver and prevention populations and what that would look like. And so we worked with our stakeholders across the state to sort of say, what is a candidate? Who are the populations in which we're trying to prevent from entering our foster care system? And what does that look like? And so for us, we basically defined it as any child or youth who's at imminent risk, which is a required sort of litmus test of entering foster care based on either an alleged maltreatment or maybe just a circumstance or a characteristic of the family or the parent or even the child that in some way affects the parent to safely care or nurture for that child. So that sounds like a really, really broad statement. And so we've tried to sort of define what that looks like. Is it families that are experiencing substance use or addiction or mental illness? Is it just a parent who's in need of parenting knowledge around child and youth development? Or, is it just the support of a parent with a child with a developmental delay or a delay of their own, or physical or intellectual disability? Is it support of a previous adoption or a guardianship arrangement that may disrupt? Or is it just support of parental resiliency and concrete resources in general as well? And so we've tried to make this definition serve what we know makes sense for Florida, but it is a very broad definition that covers, as I mentioned before, multiple doors of entry, not just our hotline and child welfare system.
And that lends itself to our next conversation. And it's really around the specific activities that Florida has to do to take advantage of the FFPSA funding for their EBPs. Can you tell us a little bit more about that?
Yes. So in addition to a child being assessed at imminent risk for foster care or a candidate, and that's the definition I just sort of walked through, the state also has to have an approved Title IV-E prevention plan. So basically, before we can begin claiming, the state has to submit their prevention plan for approval from the Children's Bureau and get our sort of operationalized approach or prevention response approved by the Children's Bureau prior to being able to claim. So in that plan, we have to define what our definition for candidacy is, but we also have to be able to define for them what is our prevention planning, our co-construction of prevention plans with families going to look like. And there has to be an evidence-based prevention service present in that prevention plan for us to be able to claim. And that prevention service, as we just talked about, has to be one of the services that's been rated by ACF on their clearinghouse, right? So it has to be either well supported, or promising. It has to meet one of those three rated criteria around the evidence that sort of supports the effectiveness of that service. So the particular EBP that's delivered to the family that we wish to claim for has to be in that prevention plan that I just talked about for the child. It has to be a child who's at imminent risk for foster care, and that service already has to be identified in our federal plan and approved by the Children's Bureau prior to claiming. Those evidence-based services that we're claiming for have to be funded through some sort of state or general revenue for match. Basically, what that means is if the federal government is already providing us grant funding or Medicaid funding, then certainly we have to be able to use our own dollars to get a 50% match on that service delivery for all well supported. But in addition to that, 50% of all the services that we claim for have to be the highest rated evidence, which is well supported. And then lastly, we have to have a really robust system set up that the Children's Bureau ACF has an opportunity to review that assures that those services are being delivered to families in the manner in which they were evaluated or to fidelity of the model. And so we have to develop and create and operationalize a pretty robust fidelity review process around those EBPs that are being delivered in Florida, as well as tie them to a larger sort of continuous quality improvement cycle that shows that truly we are achieving the outcomes attended around prevention services, which is diverting children from foster care or children who have experienced foster care, diverting them from re-entering or being re-abused in some way.
So I know that was quite a lot, but that's just the very high level pieces that have to be in place for us to be able to claim. And for Florida, one other caveat, states have to align to the required elements of placement, which I mentioned earlier was our phase 2 activities around our foster home model and licensure requirements and our congregate care requirements. And all of those pieces have to be operationalized and in place before they'll approve our prevention plan.
No, I think that was great. And as you were talking, I am considering things that I've heard, and I know that you've heard things about Florida's readiness. So, what is your response to things like, are we ready for this? Do we have enough providers on board for, making sure we have 50% of our EBPs that are well supported? Do you have a level of assurance that you can give listeners that feel that we're not ready for October?
So in terms of evidence-based prevention services, we've done a lot of work to sort of assess service arrays across the state to take stock of which of the evidence-based prevention services that are on the clearinghouse are already present in Florida and how are they already funded. So you've heard me talk about the use of state funds versus grant funds or Medicaid. And so what we've learned is there aren't a lot of these prevention services that are in operation currently that aren't already supported by Medicaid in some way or aren't already in operation maybe and being funded through federal grants. But what we've tried to do is sort of link it to a couple of things. If truly one of our first goals, which I talked about early on, is to prevent entry into foster care, then we really wanted to hone in on where do we have high removal areas where children aren't being diverted from the system and focus on those areas. And then secondly, look at where evidence-based prevention services are not being delivered in what we're calling service deserts, meaning either they're absent or the Medicaid wait lists are lengthy. And so trying to identify those particular areas and using some of our Transition Act dollars, and these are basically dollars that were allocated to the states by the federal government to support implementation of FFPSA, to seed these services in those high removal desert areas or service desert areas, but also looking across the whole state and figuring out how to weave these into service arrays for every community-based care agency and community across the state. So we're in the process currently of a huge launch around 5 key evidence-based prevention services and training providers across the state using model developers and already certified trainers to sort of seed these services in those areas where either they're absent or need more capacity, so that we will be able to set the foundation for growing evidence-based prevention services in the future. Much of the sort of talk around evidence-based services historically has been evidence-based services are very difficult to or inexpensive to first launch. They're very difficult and expensive to sustain, and then certainly to scale as well. And so we're trying to leverage as much as we can the federal support we've received to help communities do that, to initiate and at least begin sustainability around some of these services. And so we've got a great response from our community-based care agencies and the Florida Coalition for Children to help us do that, as well as our substance abuse and mental health offices, our managing entities. It's been a lot of great sort of work trying to figure out what makes the most sense for seeding these services so that there is sustainability in the future.
That is reassuring. And what I love about what you said is that sustainability piece. The idea is you all aren't readying Florida for October. You're readying Florida to surpass October and keep going and keep growing. So that's a lot of what I got, the theme of what you just said. So I appreciate that approach. I'm also curious, Ginger, because you're so deeply embedded in the preparation and the prevention plans and our readiness here in Florida. What is most exciting to you about Family First? I'm just curious.
Well, personally speaking, I think, again, as I mentioned before, historically, and I know at least for my career, a lot of the attention, a lot of the resources, and a lot of the strategies were really focused on children who were in out-of-home care. And what I saw personally, especially in my small community that I live in, is that there definitely was this element of generational abuse, that if we could just get a little bit more upstream, if we could just provide prevention services or needed services to families before that crisis sort of elevated and then sort of continued through generations, that we would have the biggest impact. And I saw that time and time again. And so, under the waiver, Florida had the opportunity to demonstrate that and saw some pretty tremendous outcomes around reduction in out-of-home care for sure. And then I think this is sort of the next step in really getting upstream on that intergenerational cycle of abuse with prevention services that could impact and truly sort of divert families from having to come in our system because of the crises they're experiencing and need support around. I truly think the sentiment and intent that ACF and the Children's Bureau is trying to achieve with this is a first step of getting all the way upstream to primary prevention, which is pretty exciting to me.
I echo that. It sounds like Florida has really internalized the vision from the Children's Bureau. I remember hearing some leaders in D.C. say FFPSA is not the panacea. It's a tool toward a much bigger vision for prevention. So now I want to kind of bring the conversation to that front line. All of us realize that we have frontline case managers and investigators that are doing this work. So I wanted to hear from you. A case manager has their first prevention caseload. What would you tell them about the vision of Family First?
Yeah, I think I would, at a very high level, just circle back to what an exciting time this is for Florida and their ability to do this really important work, this prevention work. And that I think for the first time, we're taking a step back from a historical sort of approach from child welfare on resources and strategies aimed at out-of-home care, and we're still doing that, but widening that net to say to those prevention workers, this is our opportunity. This is the thing that we typically hear from caseworkers and from investigators that they signed up to do, which is to help families as early as possible in the most family-centered way, recognizing what their data says in their community about what those resource needs are, connecting to trauma-informed services, and being able to truly change the trajectory of where that family will sort of be in 5 years or 10 years, or even, as I mentioned, generationally with this prevention work. And again, my excitement is the infusion and integration with the community and all of the community resources that prevention worker, and again, I think prevention worker takes on many, many roles and descriptions, but will have access to that's never been there before. And so I will also say to that prevention worker or that particular provider that this is going to take some time, and that this is a great opportunity for people to roll up their sleeves and get involved, be innovative, but have an impact like perhaps they haven't had before. And so that's what I would say to them.
Absolutely. And what's exciting about this series and this podcast is you are kicking us off. We have 3 more episodes. The next one will elaborate on what you touched on today. You discussed vision and how to get upstream. Another episode is going to touch on the residential group quality standards. And then we're going to end on learning about kinship navigator programs and their journey to becoming an EBP. So stay tuned. I'm so glad you kicked us off, Ginger, and I appreciate you being here with us.
Thank you. It's been my pleasure.
I want to give a huge thanks to our guests, and we are so appreciative of their commitment to improving our child welfare system. If you want to learn more about this topic or contact these speakers, please visit www.ficw.fsu.edu. Stay safe and well.